Okay, now with measles, another paramyxovirus, measles or rubiola. Measles is an acute, highly infectious disease characterized by maculopapular rash, fever, and respiratory symptoms. Complications are common and may be serious. Although a life-attenuated vaccine has dramatically reduced the incidence of the disease all over the world, however, measles is still a leading cause of death in young children in many developing countries. وهذه أيضا مثل ما حكينا بالمامس تصير لا زالت تصير outbreak of measles هنا وهناك في أماكن مختلفة من العالم، ولا زال الميزل يشكل واحد من أسباب الوفيات بين الأطفال بالعالم. والسبب the same، يا أما failure بالفاكسين أو failure بالvaccination. Pathogenesis and pathology. Humans are the only natural host for measles virus. The virus enters the body through the respiratory tract where it multiplies locally and then spread to the regional lymph nodes where a further multiplication occurs when regional lymph node يطلع من الريجنال ليمف نود يروح للبلاد وتصير البرايمري فيريميا which disseminate the virus which then replicate in the reticulo and the other reticuloendothelial system. Finally, a secondary viremia ورا ما يطلع من الرeticuloendothelial system تصير السكند فيريميا، وهذه seeding the epithelial surface of the body including skin, respiratory tract and conjunctiva where focal replication occur. seeding أي تزرع الفيروس أو disseminate the virus بالابيثيال سيرفيسز اللي موجوده بالجسم وخاصه السكين والريسبيراتوري تراك والكونجكتيف. اذا هذا الفيروس يتميز بحدوث two phases of viremia, primary viremia and secondary viremia. Multinucleated giant cell with intranuclear inclusion are seen in lymphoid tissues throughout the body, lymph node, tonsils, and appendix. The incubation period is typically 9 to 11 days. The onset of disease is usually abrupt, سريع, and characterized by coryza, cough, conjunctivitis, fever, and complex spot. Coryza means running nose or runny nose. Complex spot appear in the mouth, which is considered as a pathognomonic feature of the measles، يعني صفة مميزة، صفة سريرية مميزة للميزل. are small bluish white ulceration on the buccal mucosa على الميوكوزا مال الفم، يعني الخدود من جوا لما الطبيب يفتحها بالتانك بريسر يقدر يشوف هذا البلوش وايت ulceration. These spots contain giant cell, viral antigen, and viral nucleocapsid. During the prodromal phase, which extends 2 to 4 days, the virus is present in the tears, nasal, and throat secretion, urine, and blood. The characteristic maculopapular rash appear about day 14, just as circulating antibody are become detectable. The rash develop as a result of interaction of immune T cells with virus-infected cells in the small blood vessels and last for 1 week. Patients with defective cell-mediated immunity, there is no rash develop because, as you see, the rash formation or appearance has an immunological basis. So once the patient with defective cell-mediated immunity, so the rash is not developed. Involvement of CNS is common in measles. It appears as a light pink discrete maculopapular that coalesce to form blotches. ده يحكي على الماكيولوبابيلار راش يظهر على شكل لايت بينك ديسكريت ماكيولوبابيلار بابيولز، وهذه كواليس تندمج مع بعضها لتكوين بلوجز مثل البقع becoming brownish in 5 to 10 days. The fading rash resolve with desquamation. Modified measles occur in infants with residual maternal antibody. The prodromal syndrome diminished, complex spot usually absent, and rash is mild. هذه لما يكون الطفل باقي عنده بقايا من أو ريسيديوال من الماتيرنال أنتيبودي، راح يصير عندنا ما يسمى بالموديفايد measles infection or clinical picture. Secondary bacterial infection, mostly beta hemolytic streptococci, are common in measles. Otitis media and lower respiratory tract are common. Pulmonary complications account for more than 90% of measles-related death. Central nervous system complications are the most serious. Acute encephalitis occur in about 0.1%. Survivors may show permanent maternal changes, mental changes. Subacute sclerosing panencephalitis is insidious 5 to 15 years after a case of characterized by progressive mental deterioration, muscular rigidity, and coma. Immunity. There is only one antigenic type of measles virus. Infection confers lifelong immunity. The presence of a humoral antibody indicates immunity. The cell-mediated immunity also relevant for protection. Laboratory diagnosis. Typical measles reliably diagnosed on clinical ground. Laboratory diagnosis is necessary in modified or atypical measles or atypical clinical picture of the measles, which include isolation and identification of the virus, serology, measles-specific IgM in the serum within 1 to 2 weeks after the onset of the rash is confirmed recent infection, hemagglutination inhibition, complement fixation, neutralization tests can be used. IgG specific antibody indicate immunity to past infection or vaccination, and lastly by molecular detection of viral nucleic acid. Epidemiology. The WHO estimates that about 1 million children die annually by measles and its complication, and that 85% of these deaths occur in Asia and Africa. The virus is highly contagious, that is to say, highly transmissible. There is a single serotype with no animal reservoir. Unapparent infection is rare. Infection confer lifelong immunity. The presence, the prevalence and age incidence of Measles are related to population density, economic and environmental factors, and the use of live virus vaccine. Transmission occurs predominantly through respiratory route. Measles is endemic worldwide. Epidemic occur regularly every 2 years, 2 to 3 years cycle. Measles rarely cause death in healthy people in developed countries. However, it is a leading cause of death in malnourished children in developing countries where infection is common, with children more than 5 years old. This is a diagram showing the differentiation between chickenpox and measles virus from different aspects. For example, in chickenpox there is fever, headache, tiredness or fatigue. Appearance of red spot first appear on the chest, face and back. Decreased appetite, spot turn into itchy blisters. The spot are turned into itchy blister, itchy مصاحب بحكة. While in measles fever red blotchy rash اللي احنا سميناه الماكيولو بابيولار rash first appear on the forehead. تلاحظون على الجبهة، أول ما يظهر على الجبهة. red inflamed eye conjunctivitis صاحبة conjunctivitis تكون كلش واضحة. runny nose أو سميناها الكوريزة كلش واضحة. hatching cough and sore throat أيضا. وcomplex spot inside the mouth is very diagnostic or very pathognomonic for measles. عادة من خلال الكلينيك التشيكن بوكس البثور مالته او الرش مالته تبدي تيبس. يعني عادة تكون طبعا التشيكن بوكس هو البارزيلا هو واحد من الهربس فيروسز. فالبثور مالته تبدي تيبس كل ما تتقدم بالوقت تبدي تيبس والراس مالتها يصير اسود. فمن السهولة جدا معرفة تمييز الرش مال التشيكن بوكس عن الميزل، خاصة يعني العاملين بالحقل الصحي اللي عندهم خبرة في هذا المجال. Vaccination, a highly effective, safe, attenuated live measles vaccine is available. It is more than 95% effective. Yet measles has not been eliminated because أولا case of vaccine failure. والvaccine failure يصير نتيجة خلل في الخزن أو في النقل أو في الاستخدام أو في أي شيء يتعلق بالفاكسين ممكن أنه يسبب فشل الفاكسين أو failure to vaccinate some children before school entry أو ما نقدر عدم الوصول إلى الأطفال أو عدم تلقيح الأطفال يكون أيضا السبب الثاني لحدوث هذا الأوتبريك. وطبعا هذين الحالتين موجودة في مجتمعنا. Each children should receive 2 doses of measles vaccine. In highly risk countries, the first dose should be given at 12 months of age, and the second dose just before school entry. Both doses should preferably be given as combined measles mumps rubella vaccine. موجود هو MMR أو الثلاثي. طبعا حاليا أصبح خماسي لأنه دخلت ويا الهيموفيلس انفلونزي والبرتسز، فأصبح خماسي أو لربما سداسي. Mild clinical reaction, fever, mild rash occur in 10 to 15% of vaccine. Antibody titer tend to be lower than after natural infection, and the immunity lasts at least 18 years or probably lifelong.